Welcome back to my channel. So today's topic is heat stroke. So let me give you some details about this heat stroke. What exactly is this? What are the main reasons for having this kind of heat stroke situation and how this can be leading to causes like death. So let me give you more details about this today. So this is a condition, a serious condition actually, which is related to heat related problems. Okay, so when people are working in having a lot of physical exertion and working in summers basically at very high temperatures, so mainly farmers and people who are in that area, they are more prone to this particular problem. Okay, so the main reason for this is your body is unable to control the temperature. So we know that our body has a particular temperature, and in this particular case what happens is your body temperature starts rising rapidly. Okay, so there is a continuous increase in the body temperature that happens, and because your sweating mechanism will fail. We know that when we start sweating, our body temperature cools down. But in this particular case, what happens is the mechanism of sweating doesn't happen, because of which it leads to complications. So the temperature might go as above as 40 degrees centigrade. And this is actually a medical emergency, because under this condition, it affects or damages most of our organs like brain, heart, kidney, muscles. All of this can get damaged because of that very high temperature, because the tissues will get damaged there, which can even lead to death condition. So there is a difference between heat stroke and heat exhaustion. Okay, so what we are speaking today is heat stroke, which is an emergency situation. Here most of the case the person might be unconscious, and because he's not sweating, this can lead to the issues, and other issues like vomiting, nausea, headaches. So those are the other symptoms of this particular situation. But when you talk about heat exhaustion, there is excessive sweating in that person. So when there is excessive sweating, the condition is called as heat exhaustion, and under this condition person may have even problems like muscle cramps. So there's a difference between heat exhaustion and heat stroke. So recently we had seen a case where a farmer died because of heat stroke in Maharashtra. So this is the same situation because of too much physical activity and too high temperature working there. That might be the reason for this particular situation. So Indian Meteorological Department has given this data. So heat stroke was the reason for the death of that person. So coming to the causes, as I told you, exposure to very hot temperatures, hot environment, that is the major reason for this particular situation. Apart from that, a lot of strenuous activity like too much physical activity, no proper rest, and having too less water. So if you're becoming very dehydrated, that might be one more reason where your body temperature goes high and high. So even one more reason is wearing too much clothing. So when you wear too much clothing, the sweating activity might reduce a bit, because of which it can lead to problems. So coming to the risk factors, age also matters. So age is one reason for this particular situation. Apart from that, lack of conditions like certain times narrowing of blood vessels might be one reason for it. So you might have heard about vasoconstrictors. So taking certain medications like vasoconstrictors might lead to this complication. Apart from that, if your body is rid of sodium and water, that also can lead to problems, and certain cases it can lead to tissue or organ damages also. So coming to the symptoms, the major symptom here is your body temperature is going high and high. So if you check a temperature, it will be very high, greater than 40 degrees centigrade. And this can even lead to the altered mental state in the person. So he might be very confused. He may not be able to speak properly. Even it might lead to situation like coma. Okay, so it can be as detrimental as that. So basically it is the alteration of the sweating mechanism. So there is a normal mechanism by which we sweat, because of which the temperature of the body falls down. But here what happens is this alteration in the sweating pattern can lead to complications. And other symptoms are nausea, vomiting, too much of breathlessness, like too much rapid breathing can happen to that person. The heart rates can go very high, and even headaches can happen to this person. So this is just to show you few symptoms of heat stroke, like you can have heartburns, vomiting, weakness, tremors, headaches. So basically wearing too much clothes might be a problem, and it is better to avoid or limit your outdoor work when it is too hot, and better to drink more water, and better to avoid alcohol. So when exactly should you see a doctor? So basically, if you feel that any person who is experiencing this kind of situation, what I told you, so if you have seen that they're having this kind of problems like heat stroke kind of situation, then definitely you should call the emergency number, that is 911. Then in case you feel that this is happening and till that ambulance comes, what you are supposed to do, then this is what you are supposed to do. You have to take them to a place which is quite cooler. Okay, and if he is wearing too much of clothes, that clothes should be removed to some extent so that air circulation happens, and taking them to a shade is the best option. And finally, whatever you can have, like put some water on them or anything that makes the person cool. So in that way you can try to see to it that till the ambulance is received, this kind of first aid can be given. So this is how you can do it. Some cloth which is with water so that it's cool can be kept at the neck, armpits region, and in this way till the ambulance comes you can do some first aid, which can be very beneficial, because otherwise what happens is the temperature of the body goes on increasing, which will lead to a lot of tissue and organ damage, which can lead to the death of the person. So that is what happened in Maharashtra. The farmer died because of this situation. So coming to the mechanism of heat regulation, so this actually is a normal mechanism that happens in our body, where our body regulates the temperature. So when it is too hot or too cold, the body regulates by sweating or not sweating. So this is just to show you how that happens. So we know that a brain is the main thing which signals most of their systems. So this is how you can just have a look here. So brain, so it sends the signals to the skin cells through the nerves. Okay, so through the nerves, the signals are sent to the skin cell. So when it is too hot, what happens is our skin cells will dilate. And as it dilates, it will give out the sweat. So once the sweating is happening, your body temperature falls down. So what the temperature starts decreasing, and that's how it is sent back. The signal is sent back to the brain that the temperature of that person is falling down now. So in this way, the heat is regulated. So other way around, when your body is too cold, okay, so when the temperature surrounding you is too cold, again the brain sends the signal to the skin so that there is no dilation of the skin. So here what happens, there is no sweating that will happen. So your skin cells will get constricted. Okay, so once this happens, the heat will be conserved within your body. So that is how your body will be kept warm. So in this way, there is a normal mechanism of heat regulation that happens when you are functioning normally. That is, you're not suffering from conditions like heat stroke. But I told you, when you're suffering from heat stroke, what happens is your normal mechanism is not functioning properly. Okay, so since it is not functioning properly, there is a loss in hemostasis, because of which you will have a lot of tissue damage because of increased temperature that is happening. So more and more temperature is increasing in your body, the tissues in that particular region gets damaged. As the tissues gets damaged, the organ gets damaged finally, and that might even lead to death like situation. So this is very important, the mechanism of heat regulation in our body. We know that this is very important, for which we need to take care. So coming to the diagnosis of this, one important thing that they do is the rectal temperature check. So based on this temperature, you get to know if the person is suffering from something like heat stroke. Apart from that, there are even blood tests available to check the sodium and potassium level and even the gaseous content in the blood. So this, by checking this, they even get to know if there is any damage to the central nervous system, because we know that if a person is suffered from heat stroke, there will be damage to the CNS system, that is the central nervous system. So by checking the sodium, potassium levels and the gas in the blood, this kind of damage that has happened to the central nervous system because of heat stroke can be identified. Apart from that, even urine test speaks a lot. Okay, we know that urine test is very widely used for many checkups. Here again, what happens is when you're suffering from heat like heat related conditions, the color of your urine becomes darker. So this is one indication that you might be suffering from heat related diseases. So in this way, even urine test can be very useful. Apart from that, they do something called as muscle function test. So this is to check the damage to your muscle tissues. Okay, so if there is any damage to the muscle tissues happened because of heat stroke, that also can be checked. So these are few diagnostic approaches. Apart from that, even x-rays and other imaging tests can be done to see if there is any damage to the internal organs. So coming to the takeaway messages, we know that there is a difference between heat stress, heat exhaustion, okay, and even heat cramps to some extent. So in this way, definitely if the temperature of the person goes above 40 degrees Celsius, this is definitely going to be a medical emergency. It should not be neglected, and suitable care should be taken till the ambulance comes, so that you make the temperature low to some extent by keeping some cold press or something like that. So in this way you can save lives. And apart from that, it's always better to not work too hard in the very sunny conditions. So there, if you're working, then definitely you may have to drink a lot of water so that you stay hydrated, and in that way you can try to save yourself. So definitely we have to stay vigilant, stay safe. So thank you for watching. If you have not yet subscribed to my channel, please do subscribe to my channel. Please like the video and please share the video with maximum people. Thank you for your support.